give me an opportunity to reach out to all of you and to explain a little bit about what EASA is. And EASA stands for Early Assessment and Support Alliance. And I am Catherine Campos. I'm the EASA Care Coordinator for Community Counseling Solutions. And as you know, we serve the 4 counties, Grant, Gillum, Wheeler, and Morrow counties. The mission of the Early Assessment and Support Alliance is to identify individuals who are experiencing a first-time psychosis and to keep those individuals with the early signs of psychosis on their normal life pathways. So who does EASA serve? We serve young people ages approximately 15 to 27 who are experiencing a first episode of psychosis, and that is an episode that has begun within the last 12 months, or someone who's experiencing early at-risk symptoms. The individual has to have an IQ of at least 70 to be eligible for our program, and we also serve clients' families. What is psychosis? So psychosis is a term that describes mental health symptoms, such as unusual thought content, perceptual abnormalities, incoherent or unintelligible speech, and some other symptoms, and I will explain more about that in just a second. Psychosis is one of the most common adolescent conditions, which really surprised me. I had no idea. It's about 16 times more common than type 1 diabetes, and it's just as treatable. About 1 youth in every classroom will experience psychosis at some point in their lives. So it's a lot more common than we think. Some of the symptoms include, they come on gradually usually, and include hallucinations, difficulty filtering stimulation, so that would be like loud noises or bright lights or a lot of things going on at one time, delusions, confused thinking or speech, difficulty doing ordinary things, and inability to tell what is real from what is not real. So, for example, difficulty doing ordinary things, that might be displayed by somebody who was a high school student who was going along and doing fine in school, and then all of a sudden started having trouble getting ready in the morning and was confused about the day and what to do and that sort of thing. So they're not always the symptoms that we associate with psychosis. Anyone can develop psychosis. The causes can include not sleeping for multiple days, using steroids or other drugs, prescribed or otherwise, and many medical conditions. Genetics can play a major part, and also stress. About 3 in 100 will develop psychosis associated with a serious mental illness such as schizophrenia, bipolar disorder, or major depression. So it's really important to intervene early with these patients with early signs of psychosis, because we can support them and keep them on their life pathway so that they will continue to be productive and have a better quality of life. EASA services are evidence-based, and anybody can refer somebody to us, so it doesn't matter if it's your neighbor or you or a different medical provider, anyone. And services are provided regardless of whether the person can pay or not. So that's a really cool part of the program. There are many benefits, so many benefits. So it's very effective. It's been shown to be effective. We keep students in school. We help them avoid self-medication, because a lot of times these students are really confused and they don't know what's going on and they become afraid. And they find that if they medicate with especially marijuana or some other drugs, that seems to help reduce the symptoms in the beginning, so they think it's working and helping them. So if we can intervene early, we can help prevent that from happening. We also help reduce suicide risk, reduce risk of accidental death or harm. And one of the most important parts of this program that I really like is that we really help families reduce family conflict. So you can imagine that if you just found out that your child maybe was the one who couldn't get ready in the morning, and you thought that they were just being kind of obstinate and just not very cooperative. And then you went on to learn that they actually had a psychotic situation going on. You would be really afraid and really not know what to expect, and there'd be a lot of conflict because you might be, thinking that they were just putting you on, so you'd be telling them, come on, what's wrong with you? Why can't you get ready for school? And so you can imagine the kind of conflict that would go on in a family, and especially during this early time when parents don't know what's going on, and the individuals are afraid also. So they can be a lot of arguing and conflict. So we provide psychoeducation to help and support to help families to understand what's going on and to understand how to support their student or their family member in a much more productive manner. And we also help individuals to be empowered and to advocate for themselves. And rather than having them experience this as a traumatic situation which causes a lot of negative consequences down the road. There are more benefits. I mentioned this about adolescence, since these diseases often will come on during a period of adolescence, and this is when people are developing their identity. And so if they are undiagnosed, then they often will go on to develop an identity that's more focused on the disease and on their disability rather than on a healthy, normal sense of identity. So by intervening early and helping individuals stay on track, we can help them to complete this critical stage of development with a more positive outcome. So we give them the ability to have insight also to understand what's going on, and so that they're not so afraid. EASA supports lower doses of medication. It's always driven by the client, but the shorter the lower the dose and the shorter the use of medication, the fewer the side effects are, and usually better outcomes and faster recovery. We can cut symptom progression short by intervening early and getting the treatment that they need, and avoid homelessness. Oftentimes, people will end up in jails, involved with the legal system. They may not realize what's happening until they end up breaking a law and ending up in a state hospital. So all that can be avoided if we can intervene early. And therefore, we can increase the likelihood of keeping the person on track and in school or employed if they're working. So some of the things to watch for that we don't normally associate with psychosis are, for example, suddenly having problems reading or understanding complex sentences, and this, especially for teachers or parents who are working with their kids, could identify this more easily. Speaking or understanding what others are having trouble speaking having trouble speaking to someone or understanding what people are saying. So you might give them an instruction to, go down the hall and print 10 copies, and they might be confused and not understand what you mean by that. Or maybe ask your high school student to cook some French fries for dinner, and they would be disoriented and not understand what you were saying, and maybe not be able to communicate that either. Also, coordination in sports. So they might become kind of clumsy, tripping over themselves when they had been very agile and good athletes, and suddenly having trouble with that. And attendance and grades. In school, students will, their grades will go down, their attendance will go down. Sometimes they develop a fear for no apparent reason, so suddenly being afraid to go outside or being afraid to open the curtains or that sort of thing. Uncharacteristic, bizarre actions or statements. Sometimes they'll write something that just makes no sense at all. It's kind of like we call alphabet soup. They often tend to withdraw socially, as you can imagine, while all these symptoms are occurring and they don't understand what's going on, and they're feeling awkward, and their friends are maybe asking them, what's wrong with you? And so then they, instead of going to someone and asking for help, they withdraw and then begin to not take care of themselves. Their hygiene decreases. They can appear disheveled. And they can have changes in sleep. So if they often sleep a long time, like teenagers often like to sleep long periods of time, late in the morning, they might be getting up at 4 or 5 o'clock or something that's suddenly different, having trouble just not sleeping at all. So any kind of a disruption in their normal, what's normally their sleep cycle. And also dramatic changes in eating is another indicator. And perceptual changes. And so this is kind of like one of the students told me that when somebody was writing on the board, that the letters would move. And so like an M would just kind of jump up, and then it would go back down, and he would look, and it would look normal again. And then he'd ask his friend, did that letter move? And the friend would say, no, what's wrong with you? And so, but then he'd look again, and maybe a Y would turn or something. So perceptual changes like that would make you think that you're losing your mind. Statements, they might say something to you like, gosh, I think I'm going crazy, I'm losing my mind. But hearing voices that other people don't. Visual changes, so, like things might look kind of wavy, like maybe like, on a hot day when we look down the road and it looks like an oasis. So wavy lines, and colors being really intense, more intense than normal, sounds being more intense than normal, and experiencing beliefs that somebody is putting thoughts in your head. So, and then another person told me that there were wheels in his head, and when the wheels turned a certain way, then he could do certain things, but if the wheels weren't turning that way, then he couldn't do that task. So the goal of EASA is to be very easily accessible to people. We want to be out there and to be able to meet these people and provide really effective treatment as quickly as possible. And we have a full realm of services. We provide the assessment and the diagnosis, and we do treatment planning. One of the highlights of the program is multifamily groups. So in larger areas where there's a lot of population, we would have several families who get together on a bi-monthly basis, and we provide support and psychoeducation. In the areas that I serve, probably there would be maybe one family, but we will still conduct the multifamily group. We provide individualized counseling, and so the clients are eligible for supported employment and supported education. There's a licensed medical provider, and we have a nurse. We provide independent living skills, occupational therapy, and this program is limited to 2 years, so it's not like an ongoing thing that goes on forever. But individuals, when they complete the program, then they're able to come back if they like and be peers, which is a really important part of the program, because that shows, inspires other people so that they know that, if she can do it, then I can do it. So that's a really strong asset also. Again, as I mentioned, we work really closely with family members, and we have a full team of professionals. And of course, it's strength-based. So we focus on the strengths, not on the problems. So this is our EASA team. And I will provide you with a list of contacts so that you can call any one of us at any time if you have concerns or questions. And we really want to get the word out and ask you to please keep an eye out for individuals who you just think might possibly meet the criteria for the program. You don't have to make a decision, just refer them to us. And we will do the screening, and we will stay with that person. If they don't meet the criteria for EASA, we will refer them to the appropriate services and stick with them until that contact has been made. So we don't just say, oh, you don't meet the criteria, sorry, bye. So we will stick with them, and we will get back to the people, whoever refers them, and let them know what our decision is and why we made that decision. So I will give you contact information, and if you have any questions, I'd be perfectly happy to try to answer them for you.